I'm gaining weight in my belly, and it's so frustrating. I've gone to the doctor several times, and my labs come back normal. I eat right and work out. Yeah, that is just a really common thing that I hear. If I had $1 for every time someone told me this, I'd be a really, really rich woman. And the thing is that usually weight gain in the belly is hormonal weight gain. And I know there's certain doctors on TikToks that say that you shouldn't, quote, check cortisol. But the fact is, if your cortisol is elevated, even if it's being under stress, it is something we need to know about. The other thing is that a lot of times women who are going through menopause or the change, even several years before they actually go through menopause, can have trouble suppressing cortisol or dealing with cortisol because they no longer make as much of the hormone that shuts off cortisol in the pituitary. That hormone is called DHEA. And so if you have an issue with this, there are things that we can do to actually help the production of DHEA and actually help to control the way that cortisol is made in your body under stress. So hormonal weight gain secondary to high cortisol would be one of my best guesses when it comes to somebody who has belly fat. The other thing that I would look at is high estrogen levels. So being estrogen dominant can actually cause a larger belly, and that can come from several things. It can come from genetic issues with getting rid of estrogen, so the CYP1 gene or the COMT variants. People with those can sometimes have trouble getting rid of estrogen. And depending on which one you have, we do different things to help you with that estrogen dominance. A lot of times people can also become estrogen dominant at menopause because they stop making progesterone earlier than they stop making estrogen. And so they become what's called relatively estrogen dominant. There can also be estrogens in the environment, what we call xenoestrogens, that mimic estrogens in the body that can cause this sort of weight gain. And those usually come from things like plastics and cans. A lot of cans still have BPA in their lining. BPA in bottles is another source of estrogen. And there's also things like parabens in makeup and personal care products that can act as xenoestrogens. To get a full list, look at the Environmental Working Group's Skin Deep app. This has been Dr. Emmy.